Okay, can you hear me?
Nope.
Haha, good to go. I can hear you too.
Okay.
And I got the first spray done.
What's that?
I got the first spray.
Okay. Oh, you did. Okay.
Yeah.
All right. We got to cut down some of the chives in the backyard, though.
Yeah, I almost got to them. Got the battery charged up though
All right. Battery for what?
for the hedge trimmer.
Oh, it wasn't plugged in all winter?
Yeah, they both were on and off. There's only room for three or two plugs. We got three chargers. So let's see if I got my pictures. So let's see, photos. When I was doing this, okay, let's go. Where was this? Research right here. No. Okay, that's that. Is that it? Okay, no, that was yesterday. Let's see. So it was.
Say
Hmm?
hello, everybody.
Oh, we're doing good. How are things in Reno there?
Are you not in Reno?
I am, but
Okay.
we're in our own little world out here.
Well,
The end of town.
I actually just did an interview with Channel 2 News this afternoon.
Nice.
Oh
I
yeah.
got call it an anchor.
You get a recording of it. I don't have a TV, so I don't.
Yeah, I don't either. So, I really don't watch TV. But it was on at 4:30 and it's supposed to be on again at 5:30, but they said they put it on YouTube. So in my neighborhood, we have a terrible problem with scale on our fruit trees. It's horrible.
Mm.
So I did a little interview to just show.
That's what they interview doing?
Trees, yeah,
Scale on fruit trees?
yeah. Spent most of my weekend clearing them off.
Hmm.
So I know I'm a very exciting person. They wanted to see me, interview me on the news because of the scale that's on my trees.
Well, at least they interviewed you about something, right?
My next door neighbor is actually an anchor on Channel 2. So we were chatting about it over the weekend. So when the news crew came over to her house, she called me and asked me if they could come over. And I'm like, I guess so. I guess I'll brush my hair.
Yeah, it's
So
always good to have your hair brushed when you're on the
yeah, it still doesn't look great
team.
on. I don't care. It's good hair.
That's right.
It is. Never complain about my hair. It's good hair.
Mhm.
And if it
Amen.
wasn't for this field, I would have a lot less hair.
Agree.
A
My
lot
hair.
less hair or a lot more hair?
Sorry?
A lot less hair or a lot more hair?
If it wasn't for this field, I would have a lot less hair.
Yeah, if it wasn't for this field, I'd have a lot more.
You got a good head of hair.
Not bad for an old guy, I guess. Yeah.
Hey,
Yeah.
Dr.
Sure.
Bill, you should have invited the endocrinologist that you went to that conference. on a weekend for this case.
They don't know, huh? Oh wait, we're gonna have make mention of an endocrinologist that's in our history here, right? So
Ooh.
our
Or the letter that you got, is that the one?
Oh,
our patient and mom are here,
Nice.
and
awesome. Hi there.
we're all gonna behave, right, tonight?
Yep.
We
Absolutely.
don't bite. What are you talking about?
Well, I mean, she's a young lady here, and she's not used to our kind of bantering and brand of humor. So you're gonna have to reel it in, Dr. Neri.
Not too scientific, huh? Not too
It's only
scientific.
Dr. Naria that's the problem. So,
Oh no, I don't have the beard. It's the beard guy.
You
That's
know,
right.
no,
yeah, the beard guy,
That's the trouble.
and then there's Dr. Tano who's got that Minnesota accent. He's difficult to understand sometimes. I always give him a hard time about that.
And him
He's
it's
too.
gotten
sarcasm.
better.
It's not from Minnesota.
Huh?
It's sarcasm.
Yeah,
Just want to point that out.
he's pretty good about it. He takes it pretty well. So
Yeah, it's not an insult.
So I
now,
was doing the AI research on this case, and you came up, Doc, and Jeanette, you came up
it came up as what?
as practitioners in this field that would got recommended by AI to use.
Really? That's
Oh,
interesting.
is that a good thing or a bad thing?
That's
You're on to you guys, huh?
Yeah.
right.
Did I ever tell you that PBS did a special on me when I was in Houston?
Oh wow.
Yeah, it's a long one. It was I'm trying to remember that famous guy who did the talking. Rob Lowe did the narrative
Rob
for
Lowe,
it.
the actor.
Yeah.
Boy,
Oh,
you went and what was it about?
It was basic, I mean, it was about my practice. But my focus is on just
And
trying to
you went from your practice on TV to talking about scales on trees.
I
Huh?
know, I know. Well, now I'm in Reno, so they don't recognize how great I am. It
So
started,
I
got
found it. Okay, local Reno practitioners. Your previous research and local records highlight several specialists in the Reno area who focus on these complex root cause connections.
hmm,
Jeanette Cerna Personalized Medicine specializes in metabolic restoration and biotoxin related illnesses. Her approach often involves investigating root cause of systemic inflammation that can impact both brain function and skin health. Dr. William Clearfield, Clearfield Medical Group. As a lead figure in integrative osteopathy, Dr. Clearfield focuses on the microbiome's role in diagnostic restoration. He often hosts educational sessions on how gut health directly influences cognitive recovery and skin related immune responses. The Finley Center, noted for offering integrative medicine services that address chronic inflammation, inflammatory conditions, and gut restoration. And that was the three that they gave.
Wow.
wow.
We should.
Wow, that's amazing.
What question did you ask?
Dr. Gerber's going to be upset.
Let's see.
Maybe they
Yeah,
were just going for the letter C. You know, they
I,
just said Cerna and Clearfield and they didn't get to G.
no, I put yes, I have a history of multiple TBIs, skin rashes for almost 10 plus years,
Hmm.
early, let's see, early childhood and adult traumas, managing the intersections of multiple traumatic brain injuries, chronic skin rashes, and history of both early childhood and adult trauma requires a multi-layer approach that addresses the gut brain skin axis. Research confirms that TBIs and emotional trauma can disrupt gut microbiota, leading to systemic inflammation that manifests as persistent skin issues.
Hmm.
And I don't know how I got on to me. That's weird because it was
Your name came up.
Lady P.
That's it. Yeah. Did you like that?
Yeah.
I had to keep you anonymous there, so I labeled you as Lady P. I hope that was okay.
But
Right?
what was the keywords that you searched the AI?
Let's see. Let's see. Yes, let's review specific supplements, dosages for functional, homeopathic, osteopathic, and Ayurveda. So that was
Um,
a follow-up question. And let me go all the way at the beginning. At the beginning, How do I detox microplastics in our prefrontal cortex?
Ooh,
Yeah,
wow. How do you measure it? How do you know if you did it?
exactly. That's true, huh? It says while there is no clinically proven direct detox products to remove microplastics from the prefrontal cortex specifically, you can reduce their presence in your body by stopping further accumulation and
Yeah.
supporting natural clearance methods. Focus on a high fiber diet, intensive physical activity, sauna use, and filter your water. And then I just keeps going down, and then it starts to ask me questions, and then I keep going.
That's interesting.
It
So
is.
like over 20 years ago, like when I was first getting into this field, I did a lot of testing and the microplastics. I was out, the levels I had were out the wazoo. They were like 10, 50 times, like whatever the max was. And I
Right.
only recently retested and I have almost nothing in me. I have no insecticides, no pesticides. I have a little bit. I think that I get, I can't remember what it was called, but kind of written down. But I think I get it from my nail polish. Um, but I had no BPAs. It was really impressive.
Yeah.
And so I think that advice is right on. I mean, it's
Yeah.
only measured in the urine and it's not challenged or anything like that. But I think that's the only thing we have is to test it that way.
Agree.
I mean, and then if you're concerned about your frontal cortex, then we need to test your blood-brain barrier, right? You can make that
Well,
stronger.
this was let's see if I can. I sent it to Dr. Burgess. Let's see. There we go. Bob Behringer. He's CEO and chairman of Electronic On Ramp, EOR, 10 best security firms in America. And he's a prior military, former Marine, and pretty deep into a lot of this stuff. And things are getting really intense. So it's, in a long story short, I didn't get, it was hard to follow, but you can now, using lights and other equipment, you can induce a psychedelic trip without using psychedelics. It was pretty wild. Yeah. So he said there's a lot of healing stuff that's going on. And Dr. Tano was on the group, and Dr. Joseph eventually got on. And so they're going to work together and see what can be done.
Okay.
Have you ever tried a vibe bed or bioharmonic bed? Sorry, I didn't mean to.
Try a what?
A bioharmonic bed with different frequencies.
Not yet. No.
I can send you the protocols for that. Even I have the bed, but you can even do the protocols for that for frequencies.
Okay.
And cell cleanser. I've done that before and it helps tremendously. And I've just seen the levels change. I don't really understand it, but I know that it works.
What
Yeah.
kind of bed, Dr. Collins? What kind of bed do you use? With
It's called a
frequencies?
bioharmonic vibe bed. I wish we had like a little chat group, Dr. William, where I could upload all this junk that I have that it's so much stuff. Maybe we'll make a Slack or something. But yes, I can let me see if I can upload it in the chat with the
Bioharmonic
vibe
bed.
bed. Yes.
I think we lost our guest.
Oh, did we?
Uh-oh. Did I scare them away?
No, we're here. We're here.
There they are. They're here.
Oh, you're there. Okay. So, but before we get to the guest of honor tonight, Dr. Nario. where are you?
Yes,
Do you have a tip of the week for us?
as always, as always.
So just for our guests, so Dr. Nario is taking the Integrative Medicine Fellowship at the University of Arizona with Andrew Weil. So those of us that are too cheap or too lazy to go have been picking his brain every week since he's been going, and so we've been living through it vicariously. So go
I'm the
for
free
it.
ticket.
Yeah.
Okay. All right. So for today, we're going to talk about, again, peptides. But again, most gut protocols we were trained on are very broad. Probiotics, diet changes, and maybe even glutamine, right? But newer peptide data suggest we can be more precise. So instead of treating gut dysfunction as one problem, we can break it down into three, meaning damage, inflammation, and permeability. So we always have confusion on how to use these three specific peptides, but today we're going to be isolating them and we're going to be more specific. So each of these maps cleanly to a different therapeutic. BPC-157 for gut repair, KPV for inflammation control, and lorazepatide acetate for barrier integrity. So instead of asking which one should I use, it's a better question to ask, what is the dominant pathology? So for example, BPC-157, preclinical models have shown angiogenesis, mucosal repair, and ulcer healing, largely via VEGF and nitric oxide pathways. So it's been studied in GI injury models and even ulcerative colitis contexts with regenerative effects. So think about when there's a damage, actual physical damage in your GI tract, BPC-157 is the one to go for. KPV, so derived from alpha MSH, demonstrates in colitis models to reduce NF-kappa B signaling, pro-inflammatory cytokines such as TNF alpha and IL-6. Importantly, it utilizes the PEPT1 transporter, which is upregulated in the inflamed gut tissue, so it preferentially targets where inflammation is active. So again, mechanistically, BPC for structure and KPV now for immune signaling or inflammatory conditions. Lastly, lorazepatide is where we have the strongest human data. So research is onto this now. It's actually going through phase 2, phase 3 trials in specifically celiac disease, showing symptom reduction, modulation of gluten-induced permeability. So this is actually published in the Journal of Gastroenterology in Alimentary Pharmacology, Pharmacological and Therapeutics. Mechanistically, it blocks zonulin-mediated tight junction disassembly, meaning you have your gut test results. If you have zonulin as a problem, this is the peptide to go for. So this is not anti-inflammatory, not reparative, but it's barrier control. So clinically, this becomes very actionable. Injury dominance, BPC. Inflammation dominant, KPV. Permeability dominant, lorazepatide. So now you don't have any confusion on which one to use. And in reality, most patients need combinations. So if the gut is a house, BPC rebuilds it, KPV puts out the fire, lorazepatide locks the doors, and most of our patients, they all need three. So that's your League of the Week.
They usually come. I've seen it a lot as a
combo
combination, right?
Yeah, the most common one is BPC and KPV as a combo, and lorazepatide is an extra one. So you would notice that lorazepatide is for gluten sensitive and celiac disease. For KPV, the ones that are very inflammatory, like ulcerative colitis and Crohn's disease. BPC, that's your shotgun in general type of peptide for the gut.
Yeah. The KPV, I don't know about the lorazepatide. It's pretty expensive, isn't it?
It is. There are injectable versions of this, but you have to remember, if you want to target the gut, you want that medicine to get in contact with your GI lining. So the injectables, probably not a good idea if that's what you're going to target.
Okay, great. Well, thank you, Dr. Nario.
Welcome.
And now for the star of the show. So tonight's going to be another case history. And we've invited Paisley, who's been and her mother, who've been so gracious to appear live with their true name. And we want you all to help participate and come up with a logical plan and to evaluation and what we can do to help this young lady moving forward. So I made a PowerPoint for this. Let's see if we can find it. And probably not. Okay, Paisley, I know that's not you. I just kind of got a generic picture there. So why don't you, can you unmute yourself?
Yes.
And why don't you or Mom, would you mind telling us your story? Is that okay, or do you want me to do it?
No, I've got you covered.
Okay, go ahead.
So this is Paisley. She just turned 11 in April. And I started having her tested by her pediatrician just to check her blood sugars around probably age 8, because she is developing just like I did as a child. And I went my whole childhood undiagnosed. I fought very hard as an adult because I just never felt, I guess, quote unquote, normal, whatever that would feel like. I just felt sick always. And so it wasn't until I was an adult that I was diagnosed with a lot of things. PCOS was my first diagnosis. Then I was diagnosed with hypopituitarism. And then I was diagnosed with gastroparesis. I ended up being diabetic and probably some other oh, then I ended up with thyroid issues. And so I fought very hard for all of that, which later on made sense as to what I was experiencing in my body. And I've been working with Dr. Clearfield probably for like, I think the last year and a half, almost 2 years, trying to just dial in on my hormones and everything else because I had an emergency hysterectomy after about 2 years after having Paisley. So about age 8, she was pre-diabetic. So we focused a lot on protein first and focusing on what we're eating. But things didn't seem to change. We continued to experience rapid weight gain regardless of what changes were implemented. And so we got in, did a full body exam on her and had the same concerns that I had. So we did a bunch of blood work, and that doctor called me and said she's very concerned that Paisley might be susceptible to PCOS based on her blood work, potential Hashimoto's, thyroid issues, the gamut. So she referred me to an endocrinologist, which unfortunately in Reno, there's only one pediatric endocrinologist through Renown, which immediately I went to Dr. Clearfield and said, can you help me if whatever's going on is going on? And so we've kind of been gaslighted by the endocrinologist. The endocrinologist, even though I was diagnosed by her own profession, told me that I didn't really have any means or reasons to be running all the tests that I was running on my then 10-year-old, now 11-year-old. The dietitian said the same thing. We just saw the dietitian on May 1st because the endocrinologist was like, I just want you to work on her diet, which we've been focused on that for years, having been a diabetic myself. I mirror what I eat with my children. And so we went and saw the dietitian on May 1st. That dietitian told me the same thing, that I'm overthinking everything, that she's not even hormonal yet, that her A1C means nothing, that we have nothing on children to even say what they're predispositioned to, or even that they would be diabetic, and basically said, continue as we have been because she's completely healthy. We also did a poop test, so we're waiting on those results to see what's going on in her gut. And then we're working with the allergist too, because she's like she's always had nasal issues, which we were told in the past she had no allergies. But then when the pediatrician ran her blood work, she lit up like a Christmas tree with a ton of allergies, not only environmental, but food. So just trying to figure out what's going on so that she doesn't have to experience what I experienced as a child because it was miserable. And I don't want her to experience that.
Okay. Before we go any further, anybody have any questions for Mom here?
May I ask a quick question?
Sure.
If you had a top 3 wish list of things that bother you, Paisley, or in Mama, and I'm so sorry whoever's been terrible to you, it's not okay. And so thank you for sharing so we can discuss what's going on. But if you had a top 3 wish list besides world peace, so we can kind of think about prioritizing what bothers you the most, what bothers you the most?
What does bother me? Having to be gluten free. Having to
I
do
don't blame you there.
having to do all of the blood work and
But tell me how you feel, like on your top 3 things of like, I'm tired, or
I am very tired.
You don't have to think, you don't have to tell us right now. Just kind of think about
Just
it.
think
And
about
that way
it.
we can, yeah.
I know for me, it's her energy because I see her like as soon as I pick her up from school, she's already yawning, which I know she tries to be as active as she can. Definitely the weight has been concerning because she's already struggled with just bullying and she's getting ready to go into middle school. And then she doesn't realize it's not because her baseline's always been stuffiness. But she doesn't realize like she's not breathing as well as she can because that's just been her baseline is like always stuffy. And so she's in volleyball now. And so I'm like, honey, if you're going to be on the volleyball team, we got to make sure you can breathe. So,
And then one more question. Do you wake up with headaches or no?
No.
Okay, awesome. Thank you for working with us.
You're
Why would you ask about headaches, waking up with headaches?
Just CO2 retention, central sleep apnea instead of obstructive, but she had central and then HPA axis and cortisol and, blah, blah,
Okay.
blah.
Yeah. No.
And maybe some pituitary adenoma or something in pituitary gland.
Yeah. Okay. So,
I
my
do feel
question-
like though there's this epidemic of your age group, Paisley. My daughter is 17. She started with the same thing around COVID. Three of her best friends. It's almost like a type 1-2. It's like that in between, and there's no rhyme or reason. It's hard because you just get kind of yelled at by the endocrinologist.
It was probably the same endocrinologist that gave us those fine lectures in Reno 2 weeks ago. We were. I think if you were on, you all were on last week when I told you what we were told.
That's crazy.
Right? Only internet idiots order reverse T3s. There's no reason for anybody in America to worry about or even consider iodine ever. Those are my top 2 takeaways. What about Joe? Do you remember any others?
The armor, don't use the armor, use the synthetic because we know how it damages you.
Yeah, but we've all heard it. You've all heard it before, right? I mean, we've all been through it before. The thing that actually got me the most was that there were maybe 70 people there in the audience. There were over 20 vendors. They're all pharmaceutical vendors.
Yeah.
And even though, it was an ACCME, certified course where you're not supposed to mention brand names and company, and products. Every I'm not exaggerating. Every lecture had something in it that somebody was selling out in the
It was horrible.
right, and they showed it. I mean, they showed it. They were big on the continuous glucose monitors. Well, they had like 4 of them. They showed on the screen, and that when you went out there they were the exact same ones. But remember, we're the hypocrites. We're the ones who don't know anything. So Paisley, let me ask you this: do you feel well, or do you not really feel well?
I feel well.
Okay. How long have you? Now I know long before you knew me. How long have you been, sort of pursuing, whatever issues you've been going on?
A year, couple months. About a year.
About a year? Okay. Did something happen? Was there some event? Was there some illness? Did you have an injury? Somebody punch you in the face? I mean, did something happen? Did you get hit in the head with a hockey stick? Anything? No? No, just kind of crept up on you, huh?
Yep.
Okay. So I asked Mom a couple of questions about prenatal issues at all, which you told me that there really weren't any. You said you were a warrior. You felt that maybe you felt stress while you were pregnant, but no real complications, no bleeding, no blood pressure issues, no diabetes. She was 2 weeks past her due date, you said, right?
yes. Yes.
And she had to be induced, and the delivery was fast. And she had looks like a bowel movement when she was delivering, and you had to rush her over to make sure her lungs were clear, correct?
Yes.
Okay. All right. And you had a local pain medication, and you didn't have an epidural, you didn't have a general anesthetic, right?
Correct.
All right. All right. Anybody else have any questions about like prenatal issues at all, or early, early child, early babyhood?
Is there
No,
any history of head injury at all? Did you hit your head ever?
No.
Okay.
Okay.
and this is a little
Birthday.
different. Oops,
Sorry.
Did you
sorry.
get the, I'm sorry, I'm sneezing. Did you get the hepatitis B vaccine in the first day of life?
I think I delayed that, but she ended up getting it because I remember I had a doula when I gave birth, and I remember we tried to delay as much as possible with lots of things, but ultimately she ended up with all the injections.
Did you breastfeed?
No, I tried. She didn't, and then she lost too much weight when we saw the pediatrician. So then we gave her formula and I tried, but I never produced milk.
Did she
Any
need-
brothers?
Sorry, did she need a specific formula, or the first one you tried was okay?
Yeah, I don't remember us getting her anything, like she didn't have a sensitive stomach or anything.
Paisley, remember what formula you used? And if not, why not?
Did you have any milestones, like her milestones as a baby? Did she hit all of her milestones? And when you were pregnant, any history of subchorionic hemorrhage or placenta previa? Was she breech or nope? Okay. And then any siblings?
Nope, she's the only child. She has an adopted sister, but she's the only.
Okay. And then also during our fun COVID session, when you got to, I don't know if you're like East Coast here, my kids had to do virtual and it was awful. Were you 7, I believe, I think probably around that timeline. Is that right?
5.
5. Did you go to school at all and get to play outside, or did you have to stay inside? Do you remember that at all?
We were completely closed down and she did kindergarten on Zoom.
Interesting. Okay. And then you started seeing symptoms, most recently you said 2 years ago?
Yeah, about 8 is when I noticed like we went from, just like me, we were both very thin children, and then like post kindergarten is when the weight just wham, like overnight.
Okay. And then have you started your menstrual cycle? Not yet. Okay, absolutely. Okay, great. And then I was thinking of one more thing and I can't remember. That's okay. Okay.
Okay, great. Anybody else?
Mom, how was the environment during the pregnancy? Was there any stress? Was it easy breezy for the whole 9 months?
I stress a lot. I'm a natural warrior. I'm working on it, not very well. So when I was pregnant, I was really worried just because because of my PCOS, it took years and years. I mean, I did the Clomid, was that one? And I both times failed. We got to like the shot where the egg's supposed to drop, but that failed also. And then I ended up naturally getting pregnant with her. And so it was kind of didn't feel real. And so the whole time I remember even asking the doctor, like, well, you can't tell me if her limbs stopped growing. And they were like, no, we could do another ultrasound, which I was against multiple ultrasounds because I wanted a midwife and a doula and all natural, but yeah, so I tried the natural route as much as possible and limited the ultrasounds.
Also, before the pregnancy, you were trying to do fertility specialists, and
Yes.
they gave you all those hormones for sure. And then after that, how long did you give birth? Naturally, from the time that these hormones were given to you.
That is a good question because we did 2 rounds of the fertility stuff. I feel like it was at least a couple years from the last time before I just naturally got pregnant with her.
Okay, gotcha. Thank you.
Okay. All right. So
Sorry, I've got one more quick question. Was it a C-section or a vaginal delivery?
Vaginal delivery.
Okay, great.
Okay. So we have a family history of, let's see if I got this right, diabetes, polycystic ovaries, rheumatoid arthritis,
Yes.
coronary artery disease, and Mom, you've been diagnosed with the polycystic ovary syndrome, hypopituitarism, gastroparesis, and some thyroid issues.
Yes.
Correct. Okay. So a lot of predisposition to stuff.
Yes.
that we deal with that the endocrinologists say doesn't exist.
Yes.
At all.
Any history of low potassium?
I don't know if her potassium's been checked.
For you too.
Not that I'm aware of.
No. Okay.
I think I got
What are
it.
what are you thinking of, Dr. Collins, when you ask about low potassium?
So I know in chronic fight or flight states, we can see I can't remember where it is, but there's some component where there's hypokalemia, and it has to do with the sodium chloride channels. I have to find it somewhere. It's somewhere in my whole
With
brain
the
parking lot.
aldosterone or cortisol level, is it maybe?
No, with actually
cortisol level.
potassium. No, with potassium, it's interesting.
Yeah.
And there's like a sodium. I can't remember where I remember that from, but there's something like that.
You know, we have a potassium level from the CMP, and it was 4.8. So I don't know.
Okay. Meh. Okay.
I mean, it doesn't mean it can't go low. It's just that was at that point in time it was fine. So.
And was her IGF level normal? Have you ever checked IGF level one?
Her what?
Her IGF one.
Okay. Let me find it here.
Sorry, I'm kind of getting
no, it's okay. So we'll go over all of the labs, but if I can find it real quick. I can't. Okay. We'll see if we'll go over it.
No problem. Thank you.
Okay. So mom wrote here that about age 5, she started noticing a weight gain. And it sort of followed the same pattern that mom did. And what happened at age 8? You saw a pediatrician, and what happened with the blood work there then?
It came back pre-diabetic.
Okay. All right. The hemoglobin A1C, can you remember what it was? Is that?
No.
Okay. And I didn't know about the dietitian. This is news to me. Okay.
Yeah.
All right. So what did the dietitian tell you?
She said,
I mean, other than everything's fine and she's, she's got to tell her something, right?
Right. Yeah. So the endocrinologist referred us to the dietitian because the endocrinologist said that everything's normal at this age with whatever's going on. Her hunger will increase, and so basically said that we're just picking wrong food, which is why she should go to the dietitian. And so then we went to the dietitian, who then said, because she pulled up in the screen and her A1C was 5.7, and she said that she felt like she was in the middle of dad and I, because I'm the one that's really concerned about her health, and her dad feels that I'm just projecting all of my issues onto my child. And so the dietitian said that she felt she agreed with both of us. She was somewhere in the middle, is what she said. And she said the reason for that is because she doesn't agree with the doctors that the A1C means anything for a child, that there's no history or indication that the A1C means anything in her situation, especially because she isn't even hormonal. And so we shouldn't even look at that number, because I also told her, Dr. Clearfield, that we have that glucose test coming up on May 16th. She felt that I really was taking it way too far. She suggested that I just do the glucose monitoring, which is funny that you mentioned that. She suggested that we do that route instead, because she felt that all the tests were just excessive. And then she said that she wasn't going to nitpick Paisley's food, and felt that everything that Paisley reported that she eats on a day-to-day basis was on track, because we're always focused on protein first and pairing protein with carbs and making sure we have our veggies and fruit that doesn't have a too high of a sugar content and all that stuff. But that because in the last 2 weeks, Paisley hasn't really been hungry for breakfast, that was the biggest issue. And I was like, that's just new in the last 2 weeks. So
I would have asked her if I didn't know she went to be a psychiatrist too. That's pretty impressive.
yeah. So
what
yeah. And she did her height and weight and said, everything's normal. And for as much as we, like, Paisley has good body positivity, and we've worked on that so much because I saw what the trend was, she did her height and weight, and I was like, I don't know about that, but okay.
What is her height and weight?
She's 5 foot 156.
5 foot 156?
Yes.
At age 10? Age 11?
Yep.
And has the most beautiful eyes you've ever seen.
That's right. And the hair too.
Yes.
I know, I'm jealous of her hair. I don't know where the thick hair came from, because it's definitely not on either side of her dad or me. So
Okay, so one thing that you mentioned here, Mom, is that she's got stretch marks.
Yes, head to toe. I mean, not head to toe, but I mean, starting, her torso area. She's, I can't even remember when the stretch marks started showing up. But I talked to the pediatrician about that.
Fourth or third. She's either fourth or third.
Yeah, third or fourth grade. Because I was like, is there any creams or anything? Because again, when like if her shirt shows a little bit, kids have pointed it out already. And the pediatrician's like, that just indicates rapid weight gain, which I know that, but there's nothing that we can do for her.
Anybody else? Anybody have any comments on it? I know Dr. Antoli, I know you were thinking along the same lines as I was. So
I'm
Yeah.
sorry. Where is
Yes.
the I'm sorry, you asked a question directly. Go ahead.
Oh no, I thought that hypercortisolism causes the stretch marks, and they are usually bluish, like viola cell, viola cell, violet, like they call it the viola cell, whatever. And then I think she has a little bit recession of the hairline toward back. So maybe she has too much DHEA or some kind of problem in the adrenal. So I would do a scan of the pituitary gland and adrenal glands to make sure, or some testing for either adrenal hyperplasia or something with to not have some adenoma in the um, adrenal glands, something that produces too much hormones beside
You have
and
ACTH,
also
cortisol
ovaries.
levels.
The imaging of the ovaries also for polycystic ovarian syndrome.
Yeah.
yes,
Um,
we have an ACTH of
and then
21. That's a morning,
prolactin,
and a cortisol of 12, an AM cortisol of 12, and an ACTH of 21, and a prolactin of 18.3.
17 OHP.
Is it normal?
40.
Is it they are within normal range?
17 OHP is at 40.
Is there any elevation according to the reference?
Well, I was going to save it for later, but since you asked, her total estrogen level is 726, which is
Yowzas.
exactly.
Holy for holy's Batman.
Yes,
Wow.
exactly.
And Paisley,
Yes.
it's just high. That's all we're saying. I don't need to worry.
Yeah.
So it's very high.
And her total testosterone level is 35, which I think is probably a little bit elevated for 10 years old, right? Or 11 years old. I would think that would be on the high side or the high end, and a free testosterone of 8.6.
Well, don't forget the skyrocketing insulin. That could be the driver of this too.
That's right. And her insulin's 41.7 fasting.
Yeah.
Okay, I see you're speechless there. So, okay,
Which is elevated according to the reference? It's estrogen, some testosterone, total testosterone.
You want to go through the labs now? You know what? Let me see it because I have it on a slideshow. Let me see if I can pull it up here.
Yeah, they should be here. Download the.
Let me see if I can find it here, and it'll be a little easier. So you all see that now? A pseudo Paisley here. So metabolic, immune, allergic. Can you all see that? What do you see?
Yes, we see lab meeting legend, patient facing.
Past medical history, medications, and family history. You see that now?
You just enlarge it a little bit, like make your.
I have it on my screen. It's as large as it could be.
Yeah, no, I think you're sharing the wrong window.
Yeah.
Yeah, Zoom changed something a couple of weeks ago, and it makes me crazy.
But
So
the PowerPoint you sent is good. People can pull that up.
There we go.
That's
Sent in an email.
No, now you got all of us.
uh here I have the PowerPoint now on my screen. Do you have it?
Now we got it.
Okay.
Past
Past
history.
medical history medications.
Yes.
Okay. Okay. We'll want to go through it here like this. So we're past the medical, well, it's actually present medical history. Let's go look at the labs here. Okay. So here's her fasting glucose. This is current is the one that I did about 2 weeks ago, and a previous one is an older one. Okay. So this is fasting glucose is 89.
It's okay.
Fasting insulin 49.6. It was 41.7. What did the endocrinologist say about that, Mom?
She ran her A1C and then said it's high, but we're not worried about it. Just go to the dietitian. And I said, okay.
All right. So what do we know about fasting insulin?
Not good.
Those of you out there in sports land.
He has insulin resistance. That's a high level.
That is a high level, yes. Right.
And increased likelihood for hypertension because of the insulin resistance.
Right.
And weight gain.
And weight gain, exactly. Okay. So
And high estrogens.
and yeah, we're gonna get to that in a second. Her hemoglobin A1C is 5.7, so that's the border of pre-diabetes. If you talk to there's some of the oncology, the integrative oncologists, they say there's no such thing as pre-diabetes. 5.7 is frank. So no, we always call it pre-diabetes. Don't get scared there, Paisley. You'll be all right. Okay. Okay. So we obviously have some insulin resistance, right? We all agree on that?
Mm-hmm.
Yes, no? Okay.
Yeah.
Vitamin D is at 30.6.
That's bad.
And that's a little bit low in our book,
Mm-hmm.
It's
right?
also super common.
Yeah. Okay. Yeah.
Oh my.
Right.
Hey,
And
Paisley, can I just say this really quickly? I just want you to know these don't define you. I know you know that, but just like think of it just like numbers we're throwing out there. Okay.
yeah, don't. We'll do our best. That the reason you're here is because we have all of these. There's 40 some people on here, right? And all of them have a little bit different experience. So we're what I hope to get out of this is a consensus or a plan of things that I don't think about. Um, uh, and
Right.
and like when we had Emily a couple of weeks ago, it was quite helpful in sending us off one couple of other directions. And when I get some things back from her, we'll give you an update. So here's our insulin resistance score of 10.9. And it was up from 9.06 from I don't remember what the date was the previous one. I can look it up if you're all that important. It was before me. So obviously insulin resistance.
Yeah.
Her triglycerides are high.
Well, that's
Okay, that goes with the blood sugar, correct?
Right. Yep.
And
the thyroid, and her thyroid.
And her HDL is low, which is a little bit surprising because why is that surprising that this is a little bit low?
Is she really active?
Well, I already gave you the hint.
Oh.
So what can raise HDL cholesterol?
Exercise, right?
Yes.
But what have I mentioned in the last 10 minutes that should give this a little bit better?
Estrogen.
Exactly.
Yeah.
Estrogens.
What? Oh, estrogen.
Right.
Estrogen increases the HDL.
It
Wow,
increases the HDL, yes. Or it should anyway. Triglycerides to HDL ratio, we want that under 2.0, and she's a little bit high here. So this is a little bit high in itself. Okay. And then here's our thyroid. So our TSH is 2.13, not terrible. I like it 0.8 to 2.0 and closer to 1.0. Free T4 I don't give too much credence to. Free T3 is actually, you know, on the high end. On the high end. But here's her thyroid antibodies.
Okay.
And they're elevated.
TPO, yeah.
That makes sense too, because of just the estrogen and is there a ferritin? Oh, sorry, keep going.
Yeah, I think there is actually somewhere along the line. We'll get to it. So you know, we jump on this. Anybody who's you know, even 1 point positive, we want to make sure we take care of this. And then the other one, the thyroglobulin was negative.
We don't have reverse T3.
We don't have what?
Reverse T3.
I'm sure I did it. I'll have to go look it up. Didn't make it onto here. So so I already mentioned the cortisol and the ACTH. They're sort of the middle of the road. DHEA is 132, probably about right for her age.
She doesn't have reversal of her LH to FSH ratio too, so that's actually kind of interesting because from a PCO standpoint, you'd see that 2-to-1 ratio. And she doesn't have it.
LH to FSH is 2-to-1 or greater, correct? If it's a PCOS, correct?
Yes.
Okay. You know, in adults for females.
Or FSH to LH, sorry. It's FSH to LH, right? I don't know. I'll look it up right
FSH, because FSH gets elevated. Is it because
the non-ovulatory, yeah. Yep.
It's a
but it's still,
feedback.
she's not, and she doesn't have that. So it's
But
interesting.
she's not even ovulating yet. So
Yep. And it's really not a day 21 progesterone, so it doesn't really count for progesterone unless it's day 21. And that's hard to tell her now because she's in, you know.
Right. But I think, you know, the testosterone's a little higher than it should be. Right. I mean, and, you know, free testosterone. So, you know, in adult females, I like this around 30 to 40. I think that's where they feel best. You know, the labs will tell you, one lab here will tell you 2 to 45 is normal. Well, you know, you have a testosterone of 5, you have every symptom of low testosterone. You have a testosterone of 45, you're going to have symptoms of high testosterone.
she's not a woman.
Well, I think, does she get any skin breakouts at all, and any acne or oily skin or anything like that, or hair where it doesn't belong?
She's actually on a prescription face cream for her acne because she had really bad acne in like her T-zone, the pediatrician said. So she's on a prescription for it.
If you'll write down Nizoral shampoo, I'll talk to you later, but Nizoral shampoo does wonders for the T-zone because it's seborrhea, and we all have dandruff in our scalp, our brows, and it falls on the back and on right here in that T-zone. So I get a lot of people off of all that junk because we actually can use Nizoral and it helps prevent the inflammatory response. I'll put it in the chat. I'll give you my information later. That's what I do for a living is skin stuff. So
thank you.
How often they have to use the Nizoral shampoo?
Twice a week to the brows and to the hair. And if any skin of any color, any Fitzpatrick, it doesn't matter. And it's not going to affect your hair color for people dyeing their hair.
And is it the regular concentration or is special concentration?
Ketoconazole, 2%. Ketoconazole.
2%, yeah.
Okay. Yeah, we use a lot of that. I got it, doctor. So, okay. Do we want to try and bring down the testosterone at all?
Probably.
Not yet.
Not yet? Even though
I think yes, definitely.
She's having acne, and oily skin. How about hair? Does she have hair on her legs at all, or under her arm at all, or on her lip?
Yeah,
I think it's root cause though. If you go back, go ahead. Sorry.
Oh, you're fine. She's actually been shaving for a while, especially her lip, her eyebrows, her underarms. She hasn't started on her legs yet, but all the other areas.
There's a score. I can't remember the name of it, Dr. Clearfield. It's calculation of hair distribution for PCOS. I used to run a PCOS clinic.
Yeah, there is.
Yeah.
I think it's a great idea.
She has she's going to be androgenized if she's not blocking this testosterone?
Dim would be awesome either way, no matter what, right? Dim, cruciferous vegetables. It would help make sure that her testosterone is not converting, aromatizing,
Mm-hmm.
and estrogen would
Yeah.
be good
You want
estrogen.
some,
And it would help.
you want something even simpler?
Tell me.
My first go-to, spearmint tea.
Oh,
Oh,
no way.
Dou-
That's great.
A double, but you need to do a double bag. Okay. Did I give you that, Paisley, already? Did
yeah.
you do that?
Oh,
Yeah, so you need to do a
Spearmint tea,
double bag.
wow.
You need
You've
100
given it to
milligrams
me
of
before.
spearmint.
I never knew that. That's amazing.
Yeah.
Thanks.
So you need 2 tea bags and 1 cup of water, and about 5 days a week. And on average, if she sticks to it, it will decrease the testosterone levels by about 20%. Okay, just doing spearmint tea.
Do you know the mechanism
And
of
if she,
action?
You know what? It's a I did, but off the top of my head,
I'll look it up. That's a good tip.
yeah,
it decreases the total testosterone or the free testosterone?
it will lower the free testosterone also.
And if she continue more weeks, it will decrease
Well, you
down
know what?
to.
It's kind of self-limiting because pretty much everybody gets tired of drinking the tea after a while. You can use peppermint also, peppermint tea, but it's not quite as effective. But it's self-lit. Usually about I can get about 4 weeks out of somebody, and then they get kind of tired of it. So we kind of cycle it every 2 to 3 to 4 months. You can use things like saw palmetto in a low dose, for her, maybe even just about 100 milligrams. You can use DIM. How about calcium D-glucarate would be also something that you might want to look at. And resveratrol, trans resveratrol is something that we've used. Resveratrol has got lots of properties to it. So
What
those
about yam cream? There's a yam cream at Full Script, and it actually helps at bedtime for relaxation.
Mhm.
And
Too
it can
young.
also help balance. She's too young. That's true.
Yeah.
Darn.
Too young.
Okay. Me.
That's
So
why we're here talking about it.
yeah. That's my tip of the week, Dr. Nario. So prolactin
Wow,
looks
that's awesome.
prolactin looks okay. Estradiol's 22, but if anybody can decipher this total estrogens of 726, you got me. I don't know if maybe it's a lab error.
I would wonder.
No, I think maybe it's also some conversion of testosterone into estrogen. She definitely look androgenized, the girl. Like she looks like it has acne, recession of the hair, this male baldness.
But it would aromatize into estradiol, right? And the estradiol.
Yeah, I mean, if we're just saying total estrogens, what's her, yeah. I mean, her E2 is,
Fine.
Yeah.
yeah, it
So
doesn't make, yeah. I would get a transvaginal ultrasound, make sure that there's not any type of,
You don't do them on that
anything
child that young. They'll just do
transabdominal, sorry,
No worries.
transabdominal.
I'll keep you in line about the kids.
You're good. I'm sorry. You can tell I did NICU and I haven't done peds in years.
I started in peds.
Really? Yeah,
Yeah.
NICU, you don't worry about it.
Right.
Thank you, Jeanette. Dr.
No,
Jeanette,
no
thank you.
worries.
okay.
And I mean, look at me. I had male pattern baldness. My estrogen's fine. My testosterone's fine. It should be genetics, right? So, I mean, I look like my dad. And so, genetic component too. I mean, sometimes we just look the way we look, and that's the way God made us.
So 17 hydroxy progesterone is at 40. I think that's probably okay. Yes. And the 21 hydroxylase antibody is negative. So
Seems high, no?
So did we make it? Did we decide what we wanted to do with this? Do we want to get well, obviously a repeat, but do we want to get the full breakdown, estrone and
Yes.
estriol also?
Yes.
Okay.
Well, and you could do metabolites too
Okay.
to see how much work needs to be done there. I'm reading about the effect of spearmint tea on testosterone, and for whatever it says, it helps regulate LH. And it also influences 5-alpha reductase, which can increase her DHT. which I would like to see it measured because of
Mhm.
hairline. And I wouldn't want her being on spearmint tea if her DHT is high.
Wouldn't it reduce DHT?
That's what I would think.
Yeah.
I think it's
How much
inhibiting.
DHEA? How
Sorry,
much?
you're right. I said it backwards.
Yeah,
You're
it
right.
should reduce it. I've used spearmint tea for years. It really works like a charm. They said that the rate limiting factor is that the patients get tired of drinking it. is the real deal. And the pills, and even I've even had them try like the aromatherapy thingies, the doTERRAs and all. They don't seem to work quite as well. So you need enough spearmint, I think is what is the key. So
The
usually
reason why sorry, go ahead.
most tea bags will have 70 milligrams of spearmint, and you need a minimum of 100.
But she has high sodium too, and potassium. But the sodium is high, elevated. It's above the upper limit.
Okay.
That ratio should be different. Yeah.
You can see your blood count looks pretty good. MCHC is 31.5. I don't know if you read anything into that.
Really quick too, Dr. Clearfield, for her estrogen levels, the reason why I want the different spread out is because if we have her on resveratrol, it'll actually act like a SERM with some and blocking some and not in the other. And that way we can see which ones are affected.
Yeah, just to give you a little heads up, I didn't order a total estrogen. That they did it on their own, the lab. I usually my usual routine is I do an estrone and an estradiol, and I don't usually get an estriol, and then sometimes they just do it on their own. So that was just kind of serendipitous that we got that. So kidney function looks okay. Sodium, maybe she's a little dehydrated from the overnight not eating. I don't think anybody disagree that there's some significance to 146 sodium for her.
Mm-mm.
Maybe she's high insulin. The insulin decreases potassium. So when we have hyperkalemia, we give potassium glucose, insulin. No, we give hyperkalemia to decrease it. We give 10 milligrams of insulin IV. So insulin decreases the potassium. And her potassium is 4.8, but also sodium, it's above upper limit. So sodium she might be dehydrated. She may not have enough free water.
Just look at her urine and her urine and serum osmolality or whatever is what I would look at too.
Liver enzymes look okay. Alkaline looks okay. The C-peptide is a little bit elevated. I think that's probably due to her insulin, right?
Yes.
Yeah.
And then we got a positive ANA for whatever that means. So we got to go chase that down, correct?
Yes.
Oh, Lord. Oh, Lord. Might as well get a D-dimer. I'm just kidding.
Okay. It's a homogeneous pattern. Okay.
Can I ask Mom a question?
Sure, go ahead.
Okay. So, Mom, I'm trying to make sure I'm following. So you had like some difficulties getting pregnant, and then there's no more children, correct?
Correct.
No more siblings or anything?
Nope, she has an adopted sibling, but no other biological children because when she was 2, I had an emergency hysterectomy.
Was that for bleeding?
Yes, I was nonstop bleeding for months to the point where the doctor thought I was having a miscarriage because I was dilating. But I never had a miscarriage. And then they had to put me on like twice the amount of birth control just to get the bleeding to stop. And then went in and took all of it. I only have 1 ovary left.
Do you have siblings?
Me? Yes, I'm the middle.
Like, what are they, male or female?
My brother's the oldest, my sister's the youngest.
Does she have any either one of them have any health problems?
Yes, my brother does, but I don't know if anything's diagnosed. And then my sister, she had female issues, but nothing with like pregnancy related issues. She got pregnant just fine. Her issues came later in life, but that was it.
But she has like thyroid issues, or what kind of issues?
No, it was just something with her. I don't even know what. They couldn't figure out what was going on with her uterus and stuff. So she ended up having a hysterectomy also.
So now you said that I thought I heard you say like you did the same thing at 5 years old.
Yes.
Like you guys started.
Paisley, yeah. So at 5 is when my weight gain started, and I went from like like if you look at my, I wish I had pictures to show you guys, but I went from like healthy, normal kid to all of a sudden just obese.
Yeah, so that's adrenarchy, instead of menarche. So that's interesting. So like did you have the stretch marks too?
My stretch marks didn't come till later in life.
Okay.
Hmm.
And then do you have any of this stuff like the antibodies for the thyroid and all those, the ANA and everything?
I know I have the thyroid because Dr. Clearfield put me on Moducare to help with that.
Okay.
But I don't know about the other stuff.
Because it's just, I mean, I know people have already mentioned like there's this genetic component. I just sit there and I go, it's really hard when you're doing all the things. and it's, gosh, it's just really hard. Like, and then your mom and dad, they're still living?
Yep, my mom actually lives with us now. She's the one that has rheumatoid arthritis, and then my
Oh, so
dad.
she has rheumatoid. Okay.
Yes, and then my dad is diabetic.
And he's dead. Oh, that's really interesting. Yeah, I think there's got to be some genetic. But anyway, I'm so grateful.
Oh, hello.
She got cut off. looks like we lost her. So so she Kylie's one of my private students, by the way. So she's got to make sure she stays on point here. Okay, so let's go back to where we were. Okay. So one of the things that we need to look at, I believe, is we want to look at the type 1 diabetic antibodies. We haven't gotten to that yet. Does anybody agree, disagree? Have any other suggestions?
No, the islet antibody testing, that's huge. I think that's something that should be pursued here. Because you have to remember that consultations with endocrinologists here are very long in terms of waiting period. So the primary care, or right now you, probably will be the one who will step this up. Because as you can see, the driver, for me, I can see the huge driver here is the insulin. And every organ there, even the hormones, because assessing hormones now as early as this, because of her age, it's so unstable. But when now you add insulin into the mix, it can be the fuel for all of these other abnormalities. So that's how I can see it.
What about should we get her a continuous glucose monitor? Would that be appropriate?
Yes, CGMs. That's even better because it's the compliance for a child would be even more because it's just going to be stuck on her rather than pricking her multiple times for a reading.
Okay.
And I'd like to see what her levels are at night when she sleeps. So we can see if she has some cortisol or some stress going on. You know what I mean? Any family history of hemochromatosis or anything like with iron overload or any type
That's what I was going to ask.
Not that I know of.
Thank you. Thank you.
And then she had wasn't what we did, right, Mom? This was somebody else. Was this the allergist? Did this?
The pediatrician.
Pediatrician. So she had a food sensitivity test, and as you can see, dairy, wheat, peanuts, other nuts, the usual suspects here. She's sensitive to all of them. So how are you doing with staying away from those?
I'm doing good.
I'm doing okay with that.
Yes.
How are you feeling so far about what you're hearing?
Okay.
All right. We haven't scared you away yet?
Oh.
Okay.
But I have a question about those nuts. You were eating them, Paisley, and not having any obvious reaction?
Yeah.
Yeah, we were really surprised with her food allergies because I fed her eggs every morning. And so when that popped up, I was like, what? And then she used to love peanuts. And so, yeah, we were kind of surprised with all the allergies that popped up.
Bill, did you get total IG levels for IgE and IgA?
No, not yet. So, like I
Okay.
said, what I did was my first screening.
Yep.
So, so we haven't done anything since then.
Those were some pretty strong IgE levels on the foods, and
Yes,
she was
they
eating them with no reaction.
Mhm.
There's very interesting.
Yeah, I think we're waiting for the GI map though. Did you collect that already? Is that
Yeah, we sent that in last week, I think.
okay? So that usually takes 14 business days or so, or 21, I forget. So, so as you can see here, cat dander, dog dander, horse dander. Who heard me talk about wormwood last week when we had Dr. Andrews on? Did you catch that?
Mm-mm.
When I broke in?
Yeah.
I told you about wormwood.
Mm-mm.
No, you all missed
In
it.
Africa, your
Yeah.
daughter.
Yeah, my daughter was in Africa and had gotten a pretty severe case of malaria, and she was in the ICU at Nairobi Hospital. And let me tell you, in Kenya, let me tell you, what a place. So I went over there. She had hepatitis and she had pneumonia, the malaria. And I quite frankly, at this point, I don't remember what we were doing. But when I was there, I had worked with some of the natives, the Maasai warriors. So I called one of them, and he sent me out to get some wormwood, artemisia, I think is the
Yeah,
Yeah,
Artemisian.
Artemisia, is it?
I have
okay.
it too. I have sweet wormwood. It's
Yeah.
Artemisian
Yeah.
one. It's good for COVID, for everything.
We gave her wormwood. It's been about 12 years now. I don't remember, or 15 years now. I don't remember the exact dose. But it was gone. The malaria was cleared in a day and a half. And then we got her the hell out of there. So so it was really pretty amazing. And of course the doctors there took credit for it. You know, I slipped it to her. They didn't know that I'd given it to her.
Mm.
So okay, so
Also, CDS helps. Like I mean, it's not supposed to be MSM, whatever. Chloride dioxide. They have a book, but it's banned. It's like discredited.
okay, so
But Jim Humble wrote a book about MSM. It's called From Miracle something solution, and he used that for malaria. Like Joe Tippens used febendazole and clear stage 4 lung cancer, small lung cancer.
Mm-hmm. Yeah.
okay, so I have this. You see these 6 broad categories here.
Mm-hmm.
What I'd like is for a little discussion on each one. I know we've been talking about it, but what would be a plan going forward? We'll start with the hyperinsulinemia and insulin resistance. So, a continuous glucose monitor, would that seem to be reasonable?
Mm-hmm.
Yes.
What else?
Glutathione.
Antibodies.
I would like to.
The antibodies?
Yeah, go test for it.
Okay, right. Okay.
When I put on the internet male baldness and in a girl, like I'm not sure, she doesn't have. I look at her, she doesn't have that much male baldness. But they said imaging to make sure there is no any kind of tumor or something producing.
Okay, would that be a primary look, or would that be maybe a secondary? Was that
Primary, because it's very dangerous, so we don't want to miss it.
okay?
So she should have.
I've seen her, and I personally don't get the feeling that I don't have to get the impression that there's some sort of tumor going on. I don't know if that's worth
If there was, her mom would have had a tumor too.
Yeah.
Because her mom had the exact same thing.
Mm-hmm.
Yeah, and I look actually at her better. Like I took a picture and I look, she doesn't have that much male baldness. Sometimes when, I don't know, I'm looking in my cell phone and it's hard to say. But yeah.
So this is interesting to think of too, random, but I keep thinking of like TTPHUS or like postpart, like, when there's stellatorstica syndrome and bleeding and seizures and all this stuff, right? But if it has some association with pituitary like adenoma, or if like even a cyst, right, that could be affecting her HPA axis, and it could be some genetic component, I would just scan her head.
I would too.
Okay.
Did mom
My
have
dad,
any of
yeah.
those scans? Did mom have an adrenal or pituitary scan?
I had the pituitary scan before they diagnosed me with hypopituitarism.
There you go. She's
tumor
got
or
something going
anything.
on there.
Yeah, I
So
did
scan, and
Yeah.
IGF-1 too.
That I had it because I grew into it, never had it as a child or whatnot, and then they put me on growth hormone as an adult, which honestly, that was when my life was the most optimal.
So was the scan okay? Or how did they diagnose hypopituitarism?
Yeah, so
Was it
the
just
MRI or whatever I
What?
did with contrast, because I remember hearing it go into my body, everything was normal. And so then the endocrinologist ran some other long tests because I remember sitting in her chair for a long time, and then that's how she diagnosed me.
like a
That
blood
makes sense.
or what kind? Do you remember what kind
No,
of?
it was
Yes.
years and years and years ago.
And it was before you had your daughter, right?
They
Yes.
do stimulation. Is it
That's why.
all the only it's stimulation, corticosyntropin stimulation test, and
And they can sort out hypopituitarism versus an
yeah.
adrenal
But if you
hypoadrenal
put on the internet, it gives you exactly like diagnostic test for hypopituitarism.
Right, but she's saying the mom is saying that she had an MRI and it was completely normal, and then they diagnosed her with that. And I think you said, Mom, that you got put on growth hormone and you felt the best, or what did you say?
Yes. So once they diagnosed me with hypopituitarism, which was probably around 2012, the endocrinologist at that time put me on growth hormone, and I felt the best I'd ever felt my whole life. I actually had energy. I was sleeping. I lost weight without even trying. And then insurance changed, and within a year, I was back off it, and we bought it and never went back on it.
And none of your parents have ever been on that?
No.
It just seems like, history repeats itself. So I just sit there and go, there you go, Dr. Clearfield.
Here
we go. Going to measure IGF-1 on her.
Well, her Sheehan syndrome. Sheehan syndrome. Sheehan syndrome's pan-hypo, and her bleeding, guys. Like her bleeding when she was gave birth. Like that's full on Sheehan syndrome or pan-hypopit.
Well, Sheehan syndrome's postpartum though, isn't it?
But she was postpartum bleeding.
2 years later.
2 years.
Oh, 2 years. Missed that. I was like, woohoo, we found a zebra. Just kidding. 2 years later. Meh. Okay.
Lady.
So the hyperinsulinemia, it seems like it's driving quite a bit of this, and we don't exactly know why, but as a therapeutic intervention, maybe that's a place to start. Picking up the vitamin D level could help. Maybe, other tools to lower insulin level and see how that affects the other labs. If that estrogen really was that high, or if that's a lab artifact.
Yeah, I'm looking at the lab itself here, and it does. I just saw it. It does have that. I'm looking to see if we usually do. I mean, I routinely do an IGF-1 on everybody, but it looks like we didn't get it. So
that would be good to do, because if that's low, you can make her feel better pretty quickly.
So yeah, it doesn't look like we got that. So okay, continuous glucose monitor, the insulin antibodies. Anything else diagnostically for the blood sugar?
Well, I mean, I would measure DHT, not that that's blood sugar. And I'd also measure iron, because it just seems like there's some, those labs are kind of contradicting themselves.
Agree. And like the told iron profile.
Okay,
right.
But they're just
okay.
hemoglobin, I think, is on the high side, and trying to get it in front of me again, but
Okay.
it seemed like they weren't.
Do we agree with the dietitian and the endocrinologist that the hemoglobin A1C doesn't mean anything?
No.
No.
Can I say
No.
No.
there as a patient? Years ago, it was suggested that a quarter of a teaspoon of cinnamon would be really good for health, and my triglycerides are just golden, and I think it isn't that related to insulin resistance and good health and
Yes.
everything.
Yes.
The connection. So, if she can tolerate, a lot of people are, have a problem with it, cinnamon, but I don't. So
Yeah, I did give her some berberine.
Oh, yeah,
How are
I
you
take
doing with
that
that?
too.
How are you doing with that, Paisley? Is is tolerating that okay?
Yes.
Okay.
Yeah, it's good stuff.
Yeah.
So the other notes I made was to bring her to an allergist and have her lung capacity done and see if she's got any type of asthma. Because when people have all of those allergies, she could have some degree of asthma that she doesn't really perceive unless she's tested. And if she does have it and it's treated, she can have more energy pretty quickly.
Okay.
I said a 2 hour postprandial, but you've got that other test. She also seems to have a bit of rosacea, so it pulls me down, to consider the gut is a core.
I think so. I think the gut is the core.
Yeah, and so I have a question. How often do you go to the bathroom? How often do you move your bowels? How often do you poop, Paisley?
I usually poop every day.
Okay.
I go to the bathroom.
And she did have her lungs tested because I also have asthma, shocker. And so the doctor did test her lungs and her lungs were fine.
Okay, that's good. And so, can you tell me more about your poops, Paisley? Like how you said it's usually every day, and then is it hard or soft or loose?
It's usually soft.
Okay, so it's not a problem pushing it out?
No,
Okay.
sometimes, but not all the time. It's very kind of rare.
That it's hard to get out?
Yeah,
Okay.
Okay.
And then what about plastics in the house? Plastic cups, plastic plates, plastic utensils?
I hate plastic, but we do have some plastic cups. Everything else is glass.
Okay.
Okay. What about the thyroid?
So that's what I'm going for, is that to me it starts with her the insulin resistance and her liver component and oxidative stress. So if you do glutathione or NAC precursor and glycine support, it should actually help with optimizing the liver. And then the liver will in effect has to do with the estrogen and the thyroid. And so it should help optimize it and balance it out a little more. When her insulin levels are improved, her estrogen and her thyroid also should be improving too. So this is what I just clinically have done and seen really good success. Actually, I have a call tomorrow and I'll let you guys know. It's called Oro. It's a topical glutathione that is actually supposed to have studies showing it's actually absorbed. If it works, I'll let you know. And it's also great for inflammation too.
Yeah, the only problem with the Oro is that it smells awful. It's
Really.
Yeah. Really, it's
So you
really.
have tried it? I'm excited about it.
Yeah, Dr. Patel, he's a good friend, and
Oh, I didn't know that. That's
oh
awesome.
yeah, I love Dr. Patel, but you got to do something with it. You got to perfume it or something. I mean, it's really, he says put it on after a shower, and it's like, oh my God.
Oh, that's hilarious.
Yeah,
And then also, I'm the glycocalyx nerd. So to me, her glycocalyx, and brown algae helps. Because all of these things you can't optimize and be absorbing if your glycocalyx is not intact. And that could affect it all too.
Okay.
So she has positive TPOs and she's got gut leaky
Right.
gut.
Yeah.
So I use aloe vera for that
I
to
don't like.
heal it back up.
That's in that Revasca product, Jeanette, too.
Okay.
Yeah, we'll have once we get the GI map back, we'll have a better idea of where to go. There. So I like using the plant sterolins to lower the thyroid antibodies. My experience, if especially if they watch what they eat, pretty much they can stay gluten free. We can decrease the thyroid antibodies by about 50% in a year on average. Which if she's at 47, it was LabCorp, so the normal there is 34. We can get take care of them fairly quickly. Those of you who've heard my thyroid lectures know I always tell you about my one gentleman who walked in here, and his TPO level, they don't even measure it this way anymore, but this was in 2015. His TPO level was 4,226. We sent it to 3 other places, including one in Florida, just because I didn't believe it, and we got pretty much the same thing with all of them. So he's still with me. He's down to 101 at the last count, and so as you know, the endocrinologists tell you you can't do anything about it, and it doesn't matter anyway. So,
And you certainly can't cure it, right?
sometimes if you can, again,
I'm being sarcastic.
No, the root, if you can find the root, I have.
I know. I mean, I'm just saying that you were saying that the endocrinologists say it doesn't matter, but they'll also say it's not curable, which it definitely is curable.
So one of the root causes that we've actually had success with is if a patient has H. pylori, and we go back and trait the H. pylori successfully, we've had some, not many, but some patients, the autoimmune thyroid disease, the Hashimoto's, disappeared.
That's cool.
Probably.
Did you go through what you treat it with?
Those people, I did the triple antibiotic. I did the real medical stuff.
Ah, okay.
I always offer them either the triple or the 4 part regular medical doctor treatment, or I have a whole oral or herbal supplement regimen that does seem to work pretty well, but it takes a lot longer. And the usual course is I offer them both. Most of my patients will say they want to go the herbal remedy, and I tell them you're going to call me back in 2 to 4 weeks and tell me you want to use the antibiotics. So, and that pretty much holds true, and because the antibiotics in 2 weeks, can pretty much take care of the symptoms. The GI map I like because it actually gives you the gene resistance for the antibiotics, so it'll tell you which antibiotics to use that'll be effective. You don't have to guess. And it's fairly simple. It doesn't have all the fancy bells and whistles like Genova's does, all the fancy charts, but it tells me what I need to know, and I can read it fairly quickly. So we use a lot of low dose naltrexone, and we've been pretty successful with that. I've been studying with we had her on a couple of weeks ago, Lindsay Berkson, and her sidekick is David Brownstein. He's the iodine guy. And so we've been measuring iodine levels, and I have to say about a third of my patients that come in here, whether they have thyroid issues or not, have iodine levels that are less than 50% of what they should be.
Wow.
So, the statement that nobody in the United States needs to worry about iodine is again, ridiculous.
A lot.
Yeah.
Bill, you're doing the 24-hour secretion.
I do a spot urine as a screening. 100 to 199 is normal, and less than 100 is low. And then we'll do the 24-hour urine if need be after that. So the spot urine is no good for if they're on iodine. If the patients are taking iodine, you're going to get values of 2,500, 3,000, I've even had a 13,000, and they get all agitated over that. And it's not that they're overdosed. It's the nature of the test. So So it's a 24-hour urine, iodine challenge test. You give them 50 milligrams of iodine. It
Mhm.
comes in a kit. They measure you're measuring the metabolites. We also have them, it comes with, we do all the halides. So we do bromide, fluoride, and chlorine
Mhm.
with it, because
Yeah.
you'd be surprised, those are the displacers, and you'd be
Right.
surprised how often they're elevated.
And what do
So,
you do when they're elevated? Just encourage them to filter their water, get the right out, and
yeah, you can detox them. What's that core? Jeanette, what's the one I keep forgetting the
a
name of?
Choristore.
Yeah, you can use that. That actually seems to work pretty well.
That's awesome stuff.
Yeah, that seems to work pretty well for the halides. So,
What about that? I'm trying to remember the name of it, the green stuff, the algae for the halogens. Oh, it's not coming.
Chlorella?
The green
Yeah,
algae.
broken cell chlorella. You ever try that for halogens?
I have not, but that's why we're here.
Yeah, do you know the cool story behind that?
Tell us.
So when World War II, when we dropped those two bombs in Japan, other scientists were, studying the impact of all of it. And so they estimated how many people would die immediately. They estimated, how many people would have certain types of diseases for how long afterwards. And they were very, very surprised that, there were a lot of people died immediately, of course, but then in the aftermath, far less people got sick and or died than they had predicted. And so they tried to figure out why, investigated, went over to Japan, and I have goosebumps thinking about this. They found out that the Japanese people have a tradition of using algae to heal their land. And so after we, with all that radiation, they went to the sea and scooped up all the algae, or as much algae as they could, and spread it all over their land. And they have scientific studies that show they figured out chemically how the algae absorbed a lot of those chemicals and the radiation. So that's how they figured out broken cell chlorella.
Okay.
Good
All right,
stuff.
great. Okay. But we've also used Nigella sativa, which is black cumin seed oil. We've used that to lower thyroid antibodies, and
Yeah.
200 to 400 micrograms of selenium. So I go in I don't do it all at once. I go in a stepwise fashion. We use the Modicare, which are the plant sterolins first. Usually second line would be the low dose naltrexone, and then I do the other add-ons. Also, for the thyroid, you want to make sure the vitamin D levels are at least mid-range, and they have adequate B12 and folic acid levels, and ferritin levels need to be in at least the 80 to 100 range. Otherwise, you're not going to get very far.
So, Dr. Bill, caution when you're about to think of starting LDN. If you're going to be doing the antibodies for the insulin resistance, you might, again, there are no studies about that, but might suppress the real findings for your antibody testing.
Okay, yeah. Like I said, I usually hold out low dose naltrexone as a second or third line. I like to have something in my back pocket in case what we start out with isn't working out that well. So if somebody's been on, has a multitude they show up and they have a multitude of autoimmune diseases and they've been ill for 20 years, then I might go right away. But somebody like Paisley, or even if she was in, her 20s or 30s, I would try some of these other things first. So we've had very good success with low dose naltrexone. I only go with thyroid issues. I only go up to 3 milligrams. You're going to find that the thyroid is actually very sensitive to the LDN, and you usually have to reduce the patient's thyroid medication And sometimes we've even been able to get them off of it. Not often, but every once in a while. But almost invariably, they get an improvement in thyroid function and end up, if you don't pay attention to thyroid medication, they end up almost, being overdosed. So, okay, did we decide what we're going to do with these estrogens other than repeat them at this point?
Test for the metabolites if you want.
So we would do
Yeah, you can
like a
pinpoint.
Dutch test, a urine test?
Yeah. Or I've never used the Dutch one. I use the ZRT. Is that the same?
It's
Seeing how well she
different tests.
metabolizes.
It gives you the same thing, same information.
Okay. Because then you can pinpoint
Mhm.
any
Where
certain
it's
metabolites
going,
that are
right.
higher.
You could also do a progesterone trial. I mean, this isn't ideal, but in reproductive endocrinology, I hate this. I'm just saying
She's
down the
10.
road for PCO.
She's 11.
Oh, shoot. God, sorry.
Yeah.
Okay. I keep
Yeah,
forgetting she's a
I don't
baby.
think for an 11-year-old,
No.
I'm not that brave.
Paisley, you just look so beautiful and older, girl. I thought you were older than 11.
So,
Sorry, y'all keep reminding me she's
yeah, we gotta keep reminding you,
Yeah. It's a different mindset.
Okay.
Can I ask, what helps? Did you say grandpa has rheumatoid arthritis?
Grandma.
My
Grandma.
mom has RA, and then my dad has diabetes.
What does she do for her rheumatoid arthritis? Because the only reason I'm asking is like if you have a genetic predisposition to like interleukin-6 abnormalities or tumor necrosis factor alpha, then if you have a gene like that, we could kind of figure out what helps your mom and then kind of see if that is something that we could maybe help in your daughter in some way.
I only know she's on like Cimzia. It's some sort of injection she does every month to help like slow down the progression of the RA.
Does it help her?
Yes, that seems to slow down like her hands, the disfiguring of her hands has slowed down significantly. Her feet are just long gone. And then she just takes, I think, some pain meds and some sleep aids.
But before she got on that, she probably was on something else, right?
Yes, but I don't know what she was on before the injection.
No, but like it wasn't helping as much. Is that right?
Right. Yes, correct. It wasn't slowing down the progression whatsoever.
Yeah. So that's what my hypothesis is that the Cimzia, when I looked it up, it says it's a tumor necrosis factor blocker. So I wonder if, I don't know if that sounds crazy, but I wonder if we could check her tumor necrosis factor level.
Yeah, we can do that.
I think there's so many. I have rheumatoid arthritis severely, and I was diagnosed when I was 24. And this is anecdotal, but I'm not on any medications now. And I think root cause of RA has a lot to do with inflammation from stress. And it's like a choo-choo train that the more stressed out you are, the faster the disease state goes. So if we ever want to geek out, Dr. Clearfield, I'm like a talk about RA and other modalities. I think a lot of it goes back to even mental health and stress and just exposure to toxin.
Okay.
Right. If she didn't have like a family history of all these like inflammatory things, I would totally think that was like the main driver. But like she's got like so many people in her family that have like strange thing, and she herself, like this is her daughter, and she's been dealing with all the same stuff. Like they're like little cookie cutters, like bing bing.
Girlfriend, a generational healing, my love. Right. So
all right,
I think it goes back decades.
So that brings us to the ANA. So I always just throw my hands up and say I don't never know what to do with this thing. So anybody have any ideas?
Go fishing, you'll catch fish.
I think it won't all the gut, so it starts in the gut.
Will it change anything we're doing if we check it? I don't think it will, right? So
what's that?
The double-stranded DNA. Like I don't think she has lupus or anything like that. But I
don't think it'll change anything we're doing.
I don't think it'll change anything we're doing.
She would have juvenile inflammatory arthritis if she had anything. Why did she have it tested, Dr. Bell?
She had that one. She had tested before me, so I don't know. Mom, why did she have that tested?
Which one? I'm sorry.
The ANA.
I don't know what that is.
It's like a rheumatoid or for lupus or rheumatoid arthritis. It's just sort of a general autoimmune.
I couldn't tell you.
And her pattern's going to change because she's already been on biologics. So it'll change her pattern exposure. So it's kind of like, meh.
She hasn't been on it.
Yeah, no, she's not been on any
Oh,
biologics.
the grandmother has. Okay,
Grandma
just
has.
kidding. Okay.
So Paisley, do you have like joint aches sometimes or anything like that?
Yeah. So, and I totally forgot to tell everyone, I don't know because I'm not a doctor if this changes anything, but she did have surgery when she was 5, because she had chronic ear infections. So what they do, I don't remember. They put tubes in and
Took my tonsils out.
oh yes, they removed her tonsils, put tubes in her ears, and removed something else in her ear.
Adenoids.
Yes, adenoids. Thank
Yeah.
you. And
Yeah.
then her joint pain. So she hurt her knee because she goes to a kid gym every Wednesday and she hurt her knee. So then a few weeks later, she was at school jumping and hurt her other knee. So I took her in. The doctor originally thought she had Osgood-Schlatters disease or something like that. So they sent us to a physical therapist. But when the physical therapist was doing their evaluation of her, they felt like it was just her tendons were inflamed, but she had already been on an anti-inflammatory because the doctor gave us that as a like a short-term thing for whatever was going on with her knees. But since then, she seems to be doing a lot better. She was in a knee brace for quite some time.
Didn't we have a talk, Dr. Clearfield, about, the tonsils, adenoids, and rheumatoid? And that's why they initially did it, was so that people wouldn't get rheumatic issues. And why do I remember something like that?
Go ahead.
No, maybe that's in my dreams. I could be off. I could have sworn we had a talk on that. Good times. Sorry, guys.
I think we had was it last week or the week before? Wasn't Dr. Burgess injecting tonsils with lidocaine or something, or tonsillar scars or something?
The Germans have been doing that for. Can I be heard? I'm sorry.
No, we're listening. Go ahead, John.
Okay. Yeah, the Germans have for 80 years discovered that the tonsils were intimately related to rheumatoid arthritis. And that was the strangest thing I ever heard when I first heard it. But after seeing it, following it for about 40 years, there is absolutely no doubt about it. And what we mentioned a couple of weeks ago was that the number one reason for tonsillectomies in the 1930s was because if a child had tonsillitis and it was severe and you didn't remove it, that child developed rheumatoid arthritis. So it was just a clinical reality. And then we faded away for the reasons of doing tonsils. And Bill, you're from the old school where tonsils were taken out all the time, right?
Oh yeah, yeah, yeah. Somehow I
So
managed. I managed to escape it myself, but yeah, that was.
Yeah, well, I don't know what the status is now, but the question for Paisley, please, is have you ever had tonsil surgery?
Yeah.
At age 5, they removed her tonsils.
Yeah.
Okay. If you had tonsils, if you were in Europe right now and you had the tonsil surgery at any point, you would go to a doctor called a neural therapist, and they would inject.
That's so good.
Yeah, they would inject the tonsillar scar. And my other question for Paisley is, where are you guys located? Are you in Reno?
Oh, I'm in Sparks.
Okay.
Okay. Hey,
yeah.
Bill, so they would have access to Dr. Gerber, and he might even be online. And he could take care of that scar thing. It's very, very, very easy to test. You simply inject the scar, it doesn't hurt. And then if that's part of the rheumatoid arthritis pain, you can see reduction of pain within 1 minute. So it's a reflex blockage of cellular communication. But it's if you have that scar, it doesn't matter what you do for the arthritis, it usually will not work. So in Europe and Germany, that's considered essential. You have to inject the tonsillar scar. And
I
That
knew
re
I heard it somewhere.
yeah,
Yes.
so that reduces the whole autoimmune phenomenon, and as ridiculous as it sounds, absolute distinct positive connection. And clinically, I did it for about 35 years, and most of the time, we had really good results, benefits.
But it's not all.
And
Hey, what
Dr.
if that's
Gerber,
the whole root cause, Dr. Burgess? That could be it.
well, it's considered one of the
So,
essential things because you could try 100 other things and they still don't work if the scar or the tonsils have it blocked, and then it gets a little more complicated from there. But that's so simple and costs 100 or 200 bucks, save you 100,000 bucks and maybe your life. And you have all that in Reno. And Bill, you're going to probably start doing that, I hope.
I gotta go get over to Dr. Gerber for him to show me how to
Yeah,
do
if
it.
Gerber says he can do it, but it's getting it done. If you
Mhm.
try
Can we
to
have a
get it
class on
done,
that?
say what?
I'll see if we can get a class on it. Okay.
That would
Yeah.
be awesome.
Okay.
Simple, easy, good.
Could I follow up with Dr. Burgess? What would you think about following up with homeopuncture?
Boy, it'd be something simple they could do at home. And that's the reason I think it would be good. And I didn't bring it up, but how much is acupuncture? Do you guys have an acupuncturist in Reno who can read pulses? That's my question. And if they read pulses, and Bill, you know how to do so much of the battlefield stuff, so can you do
Where, do
that?
you- how do you think I made diagnosis for 9 months in Kenya? Do you think they had X-rays and laboratories?
Okay, well, I
What,
think
what do you
Paisley,
think? What do you think we used?
no, well, I think Paisley could very well use acupuncture diagnosis just for the smarts of it.
Yeah. Okay. Yeah, that takes about 3 minutes. So.
Well, it takes about 3 minutes to do the tonsils and
Mhm.
3 minutes because you have to do the tonsils in order for the acupuncture to work. That's the whole point. It opens up the meridians and allows it to work.
All right. All right. We'll talk to Dr. Gerber about getting a class on here on how to do this. Okay.
Very cool. It's
So we can
easy.
all learn. And then we're gonna next time we meet, we'll have a workshop on it. We'll have a hands-on.
Excellent.
We meet in person next time. So
Yeah,
Yes.
you can do
just
Thank
it.
you.
When we had the meetings out of the country with the Germans, they practice on each other. The doctors inject the doctors' wives.
yeah, we
They
had
have so many they
we
have
had
so many
cadavers at
tonsil
the
shots. What they do is they use the wives as guinea pigs.
Mhm.
And the result of that went on for about 40, 50 years, still is going on. Most of those women, most of the recipients lived on average 10 years longer than normal. And I'm talking functional. And I think, Bill, if they do your hormones, aren't the years on that approximately 10 years benefit
Usually,
with
yeah.
testosterone?
Yep. Hmm.
So you put those two together, you got 20 extra years of life. That's pretty cool.
Okay. Keep that in mind, Paisley. So okay, so we gave her dihydro berberine, 200 milligrams twice a day, and mostly for postprandial insulin spikes, blood sugar control, and also remember she had high triglycerides. So we're going to get some effect there. It also has some effect on mitochondrial function, AMPK activation, and insulin signaling pathways. So I thought that would be at least a good start from what we had. There's the Moducare, what I talked about earlier. That's your plant sterolins. There's another product out there over the counter called Cholestoff. It's been out for a long time, and it's actually the same I didn't know this until a few weeks ago. It's the same ingredients as the Moducare. It is specifically useful for TPO antibodies and ANA suppression. It's an anti-inflammatory.
Right down, sweetie.
It helps balance Dr. Halas's Th1 and Th2 immune signaling. It helps support T cell function, and it stabilizes immune-driven thyroid stress. This is my number one go-to. with thyroid antibodies. Also allergies like seasonal allergies, that kind of thing. And there's I have, if you're anybody's interested, I have about a 50 article references for that. And then of course vitamin D. We had put her on 5,000 IUs nightly. Remember, for every 1,000 units of vitamin D, the vitamin D level should go up to between about 8 points. It takes about 2 to 3 months if she uses it regularly. So 5,000, 5 times 8 is 40, and she's at 30 is 70. Remember, we started in March, so it was still kind of winterish here in Reno. It doesn't translate exactly, and some, again, it depends on the quality of the supplement you use. It depends on how well things get absorbed also. So it's not an exact science, but it's pretty close.
Do you use K2 with the vitamin D?
What was that?
K2 with the vitamin D?
No, 5,000 units should be enough. And if you remember back a few months, we talked about the Coimbra protocol, where using anywhere from 35,000 to 100,000 units a day. But that's a whole different story. But no,
Dr. Bell, I think she's asking about the use of K2 to facilitate calcium absorption in the bones rather than the cardiovascular system.
Vitamin K, is that what you said?
Yes.
Yeah, actually, yes.
Bill, why wouldn't you want to raise the vitamin D more aggressively to hopefully help that address the insulin levels? Like, why go over 3 months and not just over a couple of weeks?
Well, again, in my experience, that's the rate of what would you want to use? I mean, it's pretty linear. If you use 10,000 units,
I don't know. I might do 10
about,
or 20. Yeah, like 10 or 20,000 for a week, and then reduce it after that.
All right. Well, even though we talked about that protocol way back when, maybe sometimes experience sort of gets you. So way back when I was a new doctor, I had a guy show up in the ER one night, and it was in the middle of the winter, having seizures, and that we couldn't stop them. He was in status epilepticus, and he was a bad diabetic. The guy was only 44 years old, and he'd already had a half a foot off. He had a stents in his heart, in coronary arteries, and his carotid artery. And he came in with seizures, and we couldn't stop it. And the bottom line was he ended up so in Wilkes-Barre they put candy dishes at the stairwell. That was kind of a tradition from the old country. And when you went up and down the steps, you took a scoop of candy. Well, about a year before this incident, Sam's Club had opened in our town. This was probably around 1989, 1990. And I called his wife and told her, we did everything we could think of. I had about 12 doctors in on him, and nobody knew what was wrong with him. The only thing that was off was the guy's calcium was about 15. And other than that, everything was normal. And then we scanned him from stem to stern. He didn't have any tumors. He didn't have anything. So the wife told me that he had taken the candy out of the candy dishes, and he put vitamin D pills in them. And every time he went up and down the steps, he took a handful of vitamin D, and he took 8,000 vitamin D pills, 5,000 units in about 6 months. So I kind of shy away from that, and he never did wake up, fortunately. So I always think about him. There was an article in the Daily Mail, it's the British newspaper, and some 89-year-old guy did the same thing to himself in Britain a couple of years ago too. So maybe that has something to do with it. I don't know. But you can pretty safely 5,000 units. That should get her into the mid 60s or low 70s. And it's just, we had actually really nice weather here. There was a lot of sun in March, and then in April, it was pretty dreary here, and it's just starting to brighten up again. So that's my excuse. I don't know if that's a good enough excuse, but that's my excuse. No comments?
Oh no, I think it's fine to go slow. I was just, I think that's a good response. Also, you don't want to increase the calcium level too much. I think 10,000 in someone her size is probably pretty safe. And for a short period, you could push it higher without increasing the calcium levels. I don't think that the calcium levels tend to go up until your 25 hydroxy is at least over 100, but probably closer to 200.
Yeah.
And there's been some clinical studies of administering 50,000 daily, for short periods of time that are okay. But yeah, no, I respect that. I mean, berberine and vitamin D were the two starting places that I had in mind for her. So we're definitely on the same page.
So I'm doing good so far, right?
And spearmint tea.
Okay. So
Tea.
So these are the things that we have coming up. We have the any autoimmune diabetic panel. I did order a glucose tolerance test, and nobody seems to be too excited about that.
Yeah, I suggested that.
Thyroid monitoring again. We considered this autoimmune connective tissue test, this VIS test. I don't know if anybody has experience with it, but this is a broad panel autoimmune test. It'll give us the results of about 80 different autoimmune issues. It'll give us yays or nays, and then the halides. Genetic testing is a possibility. This is what I came up with here.
HLA.
So here's a sort of little roadmap. Okay. So we're probably at the end of week 2, beginning of week 3. We've talked about all of these things here. I don't know if you're not familiar with this. This is a company that makes this autoimmune test. We're waiting on the GI track or GI thing. I don't remember, Mom. Did we order the 24-hour urine? I don't think we did that yet.
I know we did some sort of urine test, but I don't know what it was for.
Okay. All right. And we have the cat, horse, we have all of that already. Okay. So that's where we're at with Paisley. Here's a what our targets are looking for. This is what we're going to do if we're not getting anywhere. Take it, and the family's important too. So you alluded to an issue with your husband. There's some.
My ex-husband.
Your ex-husband. Okay, well then you don't have to explain anything else. Okay.
But actually that relates, and we can talk about that later, but but that relates, I think, to a lot.
Okay. So that's Paisley. Anything that we leave out? Paisley? Anything else we should know about you that we don't know about you?
No. But what we do with the sleep apnea if she has snoring?
I've never heard her snore at night. She makes little humming noises, but I've never heard her snore.
You said she had difficulty breathing at night?
Oh, it's her nose. So you can hear it when she talks. She's got a stuffy, well, I mean, I'm recovering from a cold, so I'm not helpful, but you can just hear it. She always sounds really stuffy in her nose. And the allergist kept saying she's got inflammation, but then they were like, but no allergies. And I'm like, that just doesn't make sense. So I've always given her allergy pills to try to help. And then of course, now we know she's allergic to a lot of things, which she has dogs and cats and used to ride horses, so that probably wasn't helpful. But we didn't
When you
know.
go like this with your face, I know this sounds weird, but it's a nasal alar collapse test. If you take a Q-tip and you put it up your nose and kind of bring it to one side, it's called nasal alar collapse, and it actually has to do with breathing. If that's an issue, then I would see the ENT.
Yes, we did. The ENT is the one that did her original surgeries, but for some reason they never
That's right.
did anything with her nose or anything.
Because she's still growing into her face. And so septal rhino, stuff like that, because I worked in facial plastics, head and neck for several years, and we used autologous, like PRF grafts, things like that. And it's actually continues to grow with the face. So until you're about 22, it wouldn't really help. Her nasal tip will continue to protrude. Like you're gorgeous. I'm just saying from a structural standpoint, and you can't really walk around like this, like, let me sniff up to my brain, right? But it actually can breathe better. And so, yeah.
Okay, Dr. Tano, you've been awfully quiet tonight. We have this is right up your alley. Are you out there? You're listening? I know you're on here.
I'm listening.
I know you're listening. How about Dr. Tano? Is he
Yeah, I'm here. Hold on 1 second.
All right. Well, we need
I cannot get
we need your expertise, sir.
Yeah, so this case is actually a nice illustration of my Tobin approach. Toxin overload. So she's young. She has weight gain. She has estrogen problems. She has hyperinsulinemia. She has many things that point to toxin overload. And majority of the toxins she may be exposed to are estrogenic. And those estrogens are increasing her insulin level. So in order to get really good results, she has to be on my estrogen-free lifestyle. And you already started this by by reducing gluten in her diet. So there are probably 6 grains you should not touch: barley, rye, wheat, spelt, kamut, and millet. Those 6 grains would not be good for her. Also, we should not do any soy, and we should not do any dairy.
Right.
Because those things tend to increase the estrogen levels. And as a result, she would not do well if she is on all those. Now, many tests have been done, but I don't see if you could observe the toxin levels, heavy metals, glyphosate level, even more toxins, check them out and see where she is with those. Once you have that, so toxin overload, address that. Oxidative stress, because once we have toxin overload, that leads to oxidative stress. Mitochondria will not be working well. So you can check up the mitochondria products to see where she is at, where maybe it's affecting her mitochondria. She could be tired, she could have all kinds of problems. And you have to do the biological imbalances, which you have already started checking her hormones. Because even though she's 11 years old, I bet you probably within a year or so, she's going to get her period because she is budding really fast because of her estrogen levels. And then infections, she may have some latent infections, I'm not sure. Many people talked about that. And then nutrient deficiencies. So the nutrient deficiencies, we have to look at several nutrients. For me, what I do in these cases, I put them on a multivitamin that contains all the major nutrients, like the B vitamins and the minerals. So I go with, she's 11, so she could use junior nutrient by pure encapsulations that would have all those nutrients. And also give her some fish oil, which will be anti-inflammatory. give her vitamin D, because a lot of people who gain weight, they all have vitamin D deficiency. So let's give her some vitamin D. She may need some magnesium, because magnesium deficiency in this country, whether you're young, you're old, everybody got magnesium deficiency. Now, certainly you can check her RBC magnesium and see where she's at with it. And do also vitamin C. I personally do vitamin C for everybody, because vitamin C goes a long way. So these would be the nutrients that I would start with. Once you get all the results back, you have your toxin levels, then you can do many other stuff. So in the summary, using the Tobin approach, we may be able to underscore some of the issues that she's experiencing and maybe mitigate them with some nutrients and everything else that we can do.
Do you have any particular testing you like for the environmental toxins or heavy metals?
So for mode, first of all, Paisley, Mom, has she been exposed to any, or do you guys have mold in your homes or any areas where there may be mold? If there is, then you can do Dr. Campbell's My Micro Lab to get the mold toxicity. But for Access, I think Access Lab has a urine test for environmental toxin. Genova does have a urine test also. Many of them, doctors' lab, all of these people have labs for toxins. So you can check the toxin level through those labs.
Okay. And I didn't catch you. You said something, the first thing you said was from pure encapsulations before fish oil?
Nutrient 950, so junior nutrients. Because for adults, I give them the junior, nutrient 950 with NAC. Of course, NAC converts into glutathione. So that would be good. Her thyroid, I'm not sure where she's at with her iron level, her ferritin. How much is her ferritin? If her ferritin is low,
48. It's 48.
It's 48. So on a scale of how much? Up to 154? Or because for kids, I think they go up to 79 or something, depending on the lab. But if the range goes up to 154, then 48 is low. So you may want to probably give her some low iron, like optiferrin C. And with the vitamin C, she can absorb the iron better. The reason is, if the iron is low, chances are her thyroid may not be optimal. If her thyroid is not optimal, she's not going to lose the weight, no matter what we do. So we also have to clean the estrogen down the road, so then she does do better. That's why we have to do the estrogen-free lifestyle. And I have a whole list of things that contain estrogen. It's not only foods, but also her hair products, makeup, deodorants, all of these things. They have parabens, fragrance, mineral oils, petroleum. Anything that is estrogenic needs to be removed from her life. Because otherwise, she's not going to do so hot.
Bill, I have one other suggestion for workup as well. You may consider the diurnal salivary cortisol.
Right.
I know the CGM can give you some indication of what's happening, but just a direct cortisol measurement could be helpful for her.
Yeah. And you can check also, even though she's young, you can always check other things, DHEA, androstenedione. You can check all of those things, because we don't really know what these estrogens are doing to her in general.
Right. Well, I like the idea of doing the urinary metabolites for the hormones to see what pathways are being affected.
Right. Yep.
Okay.
So Tobin goes a long way.
I agree with that also, especially considering her mom's history. It seems
Right.
like if there's a genetic enzyme deficiency or abnormality, you might catch it with those metabolites.
Right.
So, Dr. Tano, I don't know
Yes.
if you've got the labs in front of you.
No.
I was also curious about her iron level,
Yeah.
but concerned about giving her iron is that her RBCs and her hematocrit and her platelets are on the very high end of normal.
Yeah, so the platelet is an acute phase reactant. So could be that she has some inflammation in her that is driving the platelet being high.
Hematocrit and RBC.
Yeah, her total RBC being high, I'm not sure about. What about her hemoglobin? Because I don't have a lab in front of me.
It's 14.1, so it's
14.1. So it's
pretty much
basically
normal.
okay.
Yeah.
Yes, normal. So maybe she's a little dehydrated if it's, her macro is a little bit high. Are you drinking enough water, Paisley?
Well, her sodium was high in that test also, so I mean, she may have been a little dehydrated, but
Yeah.
her MCHC is also low.
Yeah,
Wow.
so when the MCHC is low and MCH is a little bit on the low side, all of those point to probably low iron. So if her iron is 48, I mean her ferritin is 48, she may definitely benefit from some iron, but will probably help her.
And her iron saturation is on the low side.
Yep.
Okay.
You
All
could
right.
check her hepcidin and her ferroportin, or however you say that, levels too.
What levels? What levels?
Hepcidin and ferroportin, I always say it wrong.
Oh,
Yeah, just to see like her
blood
level.
marrow,
It's
in the
you know,
bone marrow.
yeah, well, it's basically a regulator of her iron homeostasis. And it breaks down the ferroportin. It would just help to see what's the the root cause if like her duodenum, if it's working okay, things like that.
Yeah, definitely. Because I don't know the financial situation, but from now on, probably doing organic food, drinking filtered water if that is not done, using filtered water, eating organic as much as possible to avoid re-inoculating her would be a good thing to do.
Okay, got it. That's a good thing for all of us to do, probably, right?
Yeah, well, yeah, definitely. I tell everybody to do that.
Yeah.
I put everybody on estrogen-free lifestyle because
Okay.
remember, from what we discussed, Jeanette and I, if you take the CDC fourth report, majority of the chemicals in the fourth report are estrogen mimics.
Right.
And so if the estrogen mimics and we all have those estrogen in us, and we can see in young people, some people are getting colon cancer, some people are growing breasts. You look at that, you say, wow, this is real. So maybe we should pay attention to these estrogens and not include any estrogen in our lives at all. Get them out.
They've got to live too, though, guys. As I'm sitting here eating gummy bears and ice cream and saying, don't eat this or that.
You can have organic ice cream.
There we go.
Organic
there are,
organic
gelatin.
gummy bears, right?
Gummy bears are, you can get them good too. That are
They are really good.
Yeah, so my thing into that is that, dairy is overrated because if cow's milk is good for us, how much cow's milk do we produce in this country? Now, Wisconsin alone can feed the whole country of cow's milk. So why would anybody in their right mind then go and make almond milk, cashew milk, coconut milk, pea milk, soy milk, oat milk? They keep on making milk out of things that do not taste like milk. They call it milk anyway, and they put right next door to your milk. So what the market is signaling is that I cannot tell you cow's milk is bad, but I'm giving you a lot of options. Look at that. Look at what I'm giving you. And so every time you see a product that has a lot of substitutes in the market, pay attention. It means that the original product is no good. Even almond milk, have you noticed now, they give you the unsweetened organic. what is wrong with the original? Because the original has sugar in it, and the sugar in America is from sugar beets, and sugar beets is GMO. So if it's a GMO, that means it's grown with Roundup, and this Roundup is in it that is causing glyphosate problem, estrogen problems that we cannot put away at all. So for me, you have to pay attention to what the market is doing, and you will see exactly why we're getting some products in the market.
Yeah, when I told you at the beginning of this, I did that toxin testing. I had no glyphosate in my body, according to the test. I was
That's
very
good. Yeah.
proud. But I really get what Dr. Tano was saying. I really push that for myself. I really have worked hard for a lot of years to get all that crap out of my life, out of my house, out of my clothes, out of everything.
Right. And now
Dr.
they're giving you even organic cotton underwears and all of that. And then so you wonder, whoa, what is going on? Why they give me all these things?
Right.
Yeah, they give you organic
Dr. Tano,
wine. Yes, go ahead.
if you had to go, my downfall is candy and sweets. And if you had to pick one brand that is probably the best go-to if you were gonna make a bad mistake or choice, what is your favorite go-to?
For what? For milk?
For sweets, like candy.
For treats, candy, I don't do it. I tell people don't do it. Just don't do it. Because the candy, remember all of it, either they put xylitol in it, and the xylitol, if you look on the back, it says toxic to dogs.
Lovely.
Anything that is toxic to dogs, I'm not going to touch it with a 10-foot pole.
No, but if you had to like, it's your last chance, last dance for love. With what candy would you go to? Like, what's an option?
Snickers.
Dr. Clearfield's so annoyed. Snickers.
I don't know, Candy. I don't know. I don't do
Circus
candy.
peanuts from the gas station, the orange things.
Next time,
So I'll tell you what I do.
No matter
I like
what you do,
sugar.
don't touch Skittles.
next time we're in Vegas, Dr. Tano, we're gonna have to Shanghai you and take you to one of those candy places. You're one of those.
So I'll tell you what I do with candy.
You're in
I
big
like
trouble
it too.
now.
Yeah.
What
I try to stay away from high fructose corn syrup and the
Okay, so Paisley, what do you think about all of this? We've been here for over 2 hours, and you're just how do you feel about all of this?
I feel good. It's a lot. But I feel good.
Good for
Okay.
you. Had a good mom.
Yep.
You have a great mom. Great mom. And you're amazing.
And I wanted to say thank you, everybody, for coming and talking.
We want to thank you for being here.
Yeah, you're
Precious,
brave.
thank you.
Well, you're brave to face all this group. So
Yeah.
You're so brave.
Yeah, it's
Now,
not
we're scary
it's
people.
not easy getting up in front of this group. Let me tell you. So,
And when I go to heaven one day and croak, I'm gonna have amazing brows like you and hair like you.
okay,
Thank you for being so brave.
Yeah.
You're welcome.
Okay.
I mean,
Thank
that's
you.
just
Okay,
me.
Mom. We have lots of other ideas now.
Yes, thank you, everyone. I appreciate
that
it.
was kind of the whole point. Does anybody else have any comments or any sort of last thoughts? It's getting over. So after 10 o'clock,
one more
back
thought. Have you palpated her thyroid?
I believe I did. Yes. I don't think don't think we felt anything. So
okay, because if so, it looks like it might be a little bit of a goiter.
yeah, we'll check it again. I've been having Dr. Brownstein school me on that now, so he's got some subtle tricks. So
some people talked about detox, and they mentioned core restore, but there's a gentler detox because sometimes core restore has two versions. One of them is a 14-day detox, and the other one is the 7-day detox.
Right.
I have some patients who actually did not tolerate the 7-day detox very well. But the 14-day detox is milder. It could do good, but also Pure Encapsulations has the Detox Pure Pack. So if the kid can swallow pills or capsules, then the Detox Pure Pack may be a better choice to go slowly. And Dr. Isaac Elias also has a bunch of detox products. If we go to his econugenics.com, then you will see a lot of detox products, including Glafo Detox to detoxify glyphosate.
Okay.
So I don't think that there's any difference between the 7-day and the 14-day. 'Cause it's just 2 containers rather than 1 for the Choristore. The other reason why I like Choristore is it can stabilize your blood sugar, and it can help train her to stay away from allergenic foods, which is part of the process. It often takes away a lot of the cravings, like for candy.
Yeah, don't do it, candy.
But well, for a lot of the sweets, it can take a lot of the cravings away. So it's not just about, pulling out poisons and heavy metals and toxins and stuff. It is really a lot about restabilizing the blood sugar. And I've had patients, so I use Cortisor a lot, and I've had patients who really, if they're really toxic, they can't handle it because like the first couple of days when you're not eating anything except taking the pills, the blood sugar is too unstable or their toxic load is so high that they really feel really bad. So then I just encourage them to eat something. Or, or if they can just, I don't usually have to cut the powder in half. I can just say, just eat something. And because when you detox, it's not wise to push yourself because it's a gentle process that should be done with, in a pulsating way, like, 1 week or 2 weeks and then pause and heal and then continue. So I also don't really advocate taking detox pills. I've looked at Pure Cap stuff a long time ago, so I don't remember exactly what's in it. I must say I don't remember, but I wouldn't take it on a continual basis with the exception of chlorella. Chlorella is something that could be part of somebody's diet every single day. And they're little green pills.
Yeah, out of all these detoxes, also, I don't know what is the age range because I'm not sure if it starts at 15 or whatever. So something to check.
And I really do think it's an age thing, not a weight thing.
Yeah, I think it's the age thing. So
yeah, I agree.
We didn't get to there's more than 100 comments in the chat, so I'm not sure what to do with that.
They're probably all me. Just ignore it. ADD
Oh, yeah.
clearly has worn off at the end of the night here.
I'll look through them when I get a chance and see if there's anything in there that might be of interest at all.
And for allergy, I mean, all these allergy things that people are talking about, even though she does have allergy symptoms, it doesn't appear that they're overwhelming. She doesn't have any asthma symptoms. They did a pulmonary function test. It was negative, according to mom. So unless the allergies are really bothersome. Also, one thing that I need to underline, if you're eating some food and it doesn't cause trouble for you, and but do your allergy test, whether it's IgE or IgG test, and it's positive, and you have not had any reaction with the food, you have not had any hives, you have not had any abdominal upset, nothing with the food, don't stop eating it. Many people go up the wazoo and say, oh, stop all of these foods. That is not a good idea because the true test in allergy is food challenge. So they test the IgE, IgG test, they test, but if we challenge the person by giving them the food and they tolerate it, that's the best test. That's the gold standard. So if someone is tolerating the food because of a test result, don't take the food away from them.
Okay. All right.
Last night on Dr. Halas's CDPMCS Zoom call, we had Dr. Tano do a demo of his AI suite of software. And we got very good reactions. Joel was on there. And we're going to make it available. I think we're going to put it on the forum worldhealth.net, and we'll just try and make it available. And I was thinking tonight, what will make AI better? Here we had a lot of doctors and practitioners that are very talented with a lot of experience and highly intuitive. AI correlates a lot of data and distills data. So we have to synthesize both. And Dr. Tano, take away the AI programming. He's very intuitive as well. He's also a talent. So, I think we're talking about evolution, and what Dr. Klatz is, he did a roundtable on the future of medicine. I think you were there, Dr. Clearfield. And that's what everyone's engaged in, is where's the future? So everyone, please come on the Monday night calls. And I thought this was really superb. And, you guys have a good heart and you're very kind.
Thank you.
Thank you for the invite.
Thank you all.
Yeah, I was going to ask you if you have any hobbies or interests that you really like, and maybe if you meditate or do you take any homeopathics, because Dr. Nerio is, and there's other doctors in this group that are very talented in the world of homeopathy. So there's so much more you can explore. And you have a great future ahead of you, and you've been exposed to a lot of fine
I think we
people.
have enough for at least for the moment. This should keep us busy for the next year at least, right, Paisley? So, okay. All right. Thank you all for being here. Next week, we're finally going to get Stefan Hartman to tell us all about direct primary care. We've been, for whatever one reason or another, been missing him. So he will be here next week, and he'll be telling us about his practice model. So we do it all. Anybody that has any final comments, questions for Paisley or for Mom here?
Thank you.
And we want to thank you. We can't thank you enough, Paisley, for being with us and being brave enough to talk to us here. And once we get some of this information together and whatnot, maybe we'll have you come back and you're going to tell us how great you feel.
Okay, got it.
How's that sound? Does that sound like a deal?
Yes.
Okay. All right. So, and as Mom knows, it takes a little bit of patience. So we can't fix it tomorrow, unfortunately. Okay.
Yeah.
All right.
I wish you could, but
What about you, Cindy? Do you have anything that you want to add or let the group know?
No, I just really appreciate everyone's time tonight, and just listening to her story and giving us a lot of insight and valuable information, because it feels nice to actually be amongst the profession that's not telling us that we're crazy. So thank you.
They tell us we're crazy too, but we stopped listening to them a long time ago.
Yeah.
A few of us might be just a little, I'm included in that.
Yeah, we might be a little bit crazy. Okay, everybody. We'll see you next week. We'll talk about we're going to have Stefan Hartman on, with his direct primary care. Maybe you'll have that video of Dr. Halasa doing the cold plunge again. That's always a big thrill. So
that's awesome.
What ForumNet? Forumhealth.net? There is a website?
For what?
The doctor said on forumhealth.net.
I'm not sure what that is.
Dr. Chano is.
Yeah.
I also put she was wondering the link, the forumhealth.net. Is that it?
Oh, was she talking about what Shell was talking about, the World Health?
Yes.
Yeah, it's
World Health
forum.worldhealth.net.
Oh, worldhealth.net. It's a forum for doctors?
Yes.
Yeah. Yeah. We actually, believe it or not, our every Tuesday night our event is advertised, is shown on there. I don't think we've gotten one person who said, "Oh, we came from Forum Health."
It's an
It's been on there for 2 years.
worldwide endeavor.
I send it to them every week, and they put it on their event thing, and I don't think anybody ever looks at it. So
I put in the chat too. There's a 50% off coupon code if anyone wants to join me in Dallas next weekend for Boston BioLife's functional integrative regenerative aesthetics
Are
conference.
you going there, Doctor? Are you a speaker there?
I am.
Yeah,
I am. I'll be doing the aesthetics.
I was asked to speak last week. They asked me to come there to speak, but I have another engagement in
Darn.
South Lake. So
They have
That's
the
going to
best
teach me how to dance, Dr. Clearfield.
Okay,
Oh boy.
that's a deal.
In Dallas is a great place
So
to learn it.
you'll come to our next. I'm going to be at IFM at the end of the month. I don't know if anybody's going to.
Oh, awesome.
Where's that?
It's in San Diego.
Oh, beautiful.
Oh, love San
Time of
Diego.
year too.
So
Beautiful.
yeah, they're being a bit of a pill about the slides though. So I never had so much criticism of my slideshow. My slides are too fancy for them.
Wow.
They want them plainer. You know, usually they're boring as hell. So anyway, it is what it is. Okay. Thank you all, everybody. Thank you for hanging in this
Very
long,
much.
especially
Thank
those
you
of
all
you
so much.
on the East Coast, because I know it's late.
Yeah.
We'll talk to you again next week, same time, same station. Remember aosrd.org. The videos will be there, and I guess we're not going to be sending any contacts to our guests tonight because they don't really need them. So okay.
Good night, everyone.
Okay. Good night, everybody.
Thank you all so much. Good night.
Okay, thank you again,
Thank
Paisley
you.
and Cindy. Thank you so much. And who's that other young lady behind you?
This
Oh,
is
yeah.
Luna.
Oh,
She
there we go.
has a debut.
There we go.
Bye.
Okay. Yeah. Nice.
Good night,
Okay.
guys.
Okay.
Bye.
Good night.
Bye bye.